Our guest is not really a guest, he's a regular around here. Dr. K, Dr. Kevin Cavanaugh, retired physician and founder of an organization called Health Watch USA. Dr. K, good morning.
Good morning, Jack.
Tell us about the history a little bit of Health Watch USA, what it's about.
Well, we're a nonprofit organization that was formed over a decade ago. We primarily have healthcare professionals, but also a lot of patient advocates. We're now around the nation and even have interest in a few people who are members from around the world. We meet over Adobe Connect or Zoom, and it concentrates right now on patient advocacy, but also on healthcare research integrity, especially infectious disease. And so that's why we've really become active with this coronavirus pandemic.
Well, I'll tell folks this, nobody does any more prep work, maybe Cruiser, he might do more than you do, but besides Cruiser, nobody does more prep for a radio program than Dr. K, and always is really great about sending me all the information that he would like to talk about. And this time you say, as sort of an added thing that we got in this morning, another important topic that we need to discuss. Just tell us about that.
Well, there have been two topics, and both are really pretty good news. People need to realize that there is a drug that's approved to prevent you from getting severely sick or in the hospital, and that's called monoclonal antibodies. And these are not being used at all. Well, I shouldn't say at all. They're being used a little bit, but there's plenty of them sitting around. And we do have them in hospitals in Kentucky. So if you're high risk for the coronavirus, that's having a comorbidity or over the age of 65, this is something you want to consider getting. But you have to be diagnosed within 3 days of your symptoms. And so you want to get that test back in 48 hours so that you can then act upon it and get this treatment. So it has to be given within 3 days of diagnosis. So for me, this is the way to go. If I was to get the coronavirus, that's the type of treatment I want to get. And because of that, I want to get an initial test that I get back in 48 hours. Now, if you're symptomatic, a rapid test is okay to get. That does require, I think, a little bit more high viral load. But if you're symptomatic and symptoms have just come on, that is going to be very likely to be positive if you indeed have COVID-19. The PCR testing, that takes longer to get back. And on that test, you need to ask, well, when is my test results going to get back? Because if it's 4 days or longer, it's not something that probably going to let you take advantage of this antibody treatment because it may come back too late. So you want to get a test fairly quickly and then contact your primary care doctor or the hospital. The Department of Health and Human Services also has on their website a list of facilities that have received this drug so that you can even contact the facility directly. And so that's something that you need to do. We need to prevent people from getting sick so we can relieve the stress on the hospitals.
So obviously you need a prescription. The doctor's got to write that.
Definitely. You'll definitely need a prescription. But if you've got a COVID-19 positive test, you're overweight, you're over the age of 65, it should be fairly easy to get a prescription. I mean, to me, that would even be a televisit. I don't think you have to go in and see someone and then go in and go to an infusion center. I think that could be probably handled over telemedicine.
Okay. But you have to be positive, and what this drug is going to do is it's going to keep you from getting more sick than you would have without it.
That's correct. It's made by Regeneron. Eli Lilly also has a drug. This is the treatment that President Trump, Chris Christie, and Rudy Giuliani received. This works. The data shows 82% of the people who get it can stay out of the hospital, which is huge, or 82% reduction is what I should say. 82% reduction. And that is something you want to get, but it has to be given early. That's the key. If it's given late, it doesn't work as well, or may not work at all.
One more time before we leave the subject, what is the name of it again?
Well, it's a Regeneron monoclonal antibodies, or just monoclonal antibodies, or if you can remember, just the antibody drug. And that should get you the medication.
All right, we're visiting this morning with Dr. Kevin Cavanaugh. And if you'd like to get on the air with us, 253-5959 is our phone number. It's also our auto text service text line. We've got some text for you this morning. If you get the non-rapid test done at the blue lot at Kroger Field near UK Hospital, results come back fast. Says, I got mine in 5 hours by email. That was from Bill. So are you aware of that?
Wasn't aware of that, but that is very, very good because you need to get the results back quickly in order to get this to work to avoid getting severely sick.
All right. Randy asks, ask your guest when we will truly know the side effects from this vaccine.
Usually it's 6 months or longer, but right now you've got 2 months of data, and that has the vast majority of side effects in it. Almost all of the side effects occur within the first 2 months. The thing that is not known about the vaccine is, one, how long will immunity last? Although Moderna has come out and said that their data indicates it probably will last at least a year, possibly longer. And number two is how effective it will be on some of the future variants and even the South African variant. It may have some decreased effectiveness with that. In other words, yeah, you may still get COVID, but you won't get it as bad with the vaccine, but you might still get it. However, the next iteration of that virus may be something that can avoid the vaccine. That's why we don't want to be spreading around the virus, because it gives the virus a chance to mutate and avoid our therapies.
All right. Now, you said 2 areas of good news. What's the second one?
Well, the second is that the Army has come out, and I know this kind of is reminiscent of the movie Outbreak, but they've been working on this for a decade. They've known about the coronaviruses, but they've come out and they've been testing a vaccine, and this vaccine is for all types of coronaviruses, and that shows promise, and they said they have promising new data. That was reported by McClatchy News Service. And so this is good because this would take care of the variants which are coming about. The current vaccines that we have, the Pfizer and Moderna, are very specific for that spike protein on that one type of virus. And so it may not have full effectiveness against some variant which comes out in the future. So this type of vaccine is actually very good news. And so it's just around the corner. So let's not act irresponsibly and get ourselves infected and then all of a sudden be in a situation where 3, 4, 5 months from now, maybe we'd be vaccinated and out of this thing. So let's just hang in there a little while longer.
Okay, here's another text, and then we'll move along, have our break, and come back. But this texter says, is the hopefully upcoming Johnson & Johnson vaccine comparable to the other 2 currently available? Does it have mRNA? Is that what we should get? The mRNA vaccine antibodies is what we should get?
Well, I have not seen the data on the Johnson & Johnson vaccine yet. I don't think that's been released to the public. I have heard that it is expected to have good results. The 2 big areas that the Johnson & Johnson vaccine is good at is, one, its storage is something that is a lot simpler, doesn't have to be reconstituted. From what I've heard, it can be stored in the refrigerator. And the other thing is that it only requires a single dose. And so that's good. If you've got to give someone 1 dose and then get them back for a second dose, that's problematic, both in staffing, making sure they get back, and in patient compliance. So the single dose vaccine has its advantages. How effective it is, I'm not sure about that because the data, I think, is still out. They will have that together when they go before the FDA for approval. But it is not an mRNA vaccine. It uses a different type of way that it makes the vaccine.
Dr. Kevin Cavanaugh is our guest this morning. He is a retired physician and president and founder of a national, soon-to-be international organization called Health Watch USA. Here's a text from Dallas. Is the antibody medication cost prohibitive? Got my first injection yesterday. Kudos to the VA. Now everybody keep those masks on and help the vaccine do its work.
Jack, I don't know, and I'll be honest with you. I would assume it would be covered by your insurance. I don't believe it is covered under the state's medication or the federal medication program where everybody gets the vaccine for free. You're just going to have to wait and see. But if you're over age 65 and you have a positive COVID test, I certainly would go on ahead and try to get that no matter what. Because number one, you're in a higher category for death. And number two, as we've talked about before, just as many, if not more people can have chronic health problems from this virus. So that's something you're going to want to do. But cost is something maybe we can look into and report back on.
Okay, John, good morning.
Good morning. Yeah, Dr. Cavanaugh, this is a question. I understand that, when we get the vaccinations, that we are still going to need to wear masks to prevent the spread to other folks. But my question was, once we've had our vaccinations and we are going to visit family, and we would be staying with them in their home, and we know that they have been vaccinated also, is there still a need to wear a mask within the home while we are visiting with them?
You mean if everybody's vaccinated?
That's
Yes.
Question. That, I'll be honest with you, I don't know guidelines on that. That's certainly going to be a safer situation. But right now, until they have this sorted out, I think they're advising that everybody wear masks. One of the disadvantages of the current vaccines is that theoretically, if you look at how it elicits an immunological response, it's primarily eliciting a response that's in the bloodstream. So the virus theoretically could still invade the nose, replicate, and there may be a short period of time that it could spread before the body or the person that has the vaccine snuffs it out. Doesn't mean the person becomes symptomatic, but they could just spread the virus. And so you probably wouldn't want to be doing that anyways. Even though it's asymptomatic carriers, you wouldn't want to be spreading it among each other. The other problem that is coming about is that we are getting new strains, and if we keep spreading this virus, you're going to get mutations, and some of these new strains may have reduced susceptibility with the vaccine, and that's of concern. Now, as far as we know, the South African strain is not in the United States, but that's one of the reasons why they have travel bans. You may say, well, we all have the virus anyways, what does it matter? Well, it matters because of the strains. And I believe that South African strain is just one or two iterations away getting a virus that's immune to the vaccine. So you probably will still want to wear a mask simply because you don't want to be spreading the virus. Even though it won't cause harm to yourselves, it may cause harm to society. And you also need to remember the vaccine, even the Pfizer and Moderna, is 95% effective. That's not 100%, but that's really excellent for a vaccine.
John, I appreciate your call. Here's another text from our auto tech service text line. How are I guess this is ivermectin studies coming along?
That I'm not familiar with. They would have to be more specific.
Okay, here's another, and we were getting short on time. Had a friend's dad who went to the hospital with symptoms and tested positive a couple days ago, left the next day to quote unquote tough it out. He's back in on a ventilator. This disease isn't something to play around with.
Well, that's correct. It tends to come and go. It tends to wane. In certain areas of this nation, they are rationing care. There's no way else to state that. California, Arizona is in a huge pickle right now. I mean, the stories I'm hearing from my medical colleagues are just terrible. So we don't want to get in that situation. It is felt that they do have the more aggressive strain as far as spreading, not as far as fatalities, but spreading. But we don't know for sure because the United States is so far behind in doing the sequence testing to determine strains. So it's a very problematic right now, and it's best to side on the side of caution. And so that's the side you want to be on. So wear a mask, follow public health advice.
Randy says that Labcore is doing free checks to see if you have antibodies from this virus for free for a year. Not sure when they start, when is the start date on that. Do you know about Labcore?
No, I don't, but that's good news. There is some feeling that if you've got antibodies to this virus or you have had an infection, that maybe you should be to the back of the line of getting a vaccine. In other words, you already have some immunity. Certainly you want to have people that are at high risk. Right now, the CDC is stating if you're above the age of 65, try to get a vaccine because they're not getting these vaccines out fast enough. And we need to do this because our healthcare system is starting to become overloaded and has become overloaded in certain areas of the nation.
Well, where do you go though? I mean, where can you find the vaccine if you're over 65?
Well, you need to call your hospital. You need to call your primary care doctor and see if you can't get on a list to get this. You also need to call your health department. Each county appears to be in different stages of getting the vaccine. And when you call up some of the health departments, they say, well, we've given it to the hospitals and it's pretty much up to them. You've got some hospitals that are giving them to all their employees, regardless of risk factor. If they work in the facility, they feel they should get the vaccine, and they're just trying to get the vaccine out there. So,
yeah, I got to go. Dr. Cavanaugh, thank you.
Thank you, sir.